And then if you have doctors that have to participate in this health plan, they can't, by definition, be practicing their Catholic faith. They may be able to have their Catholic faith privately, but when they come to the workplace, in order to implement this Obamacare, they are going to have to be a full-service gynecologist. And this plan will essentially drive out of medicine anyone who wants to live their faith. And once that piece is gone, do you realize what a huge part of our medical care is provided by Catholics and Catholic hospitals and Catholic institutions? We bring the heart to medicine. When I have someone who has a surprise pregnancy, I support them, I show them the baby, I do a sonogram, and I say, you know, this is a baby that's living in your womb, but this baby's life is in your hands. Seeing that baby in a woman's womb, seeing her own baby, so many times changes the course of that baby's existence. So many women who would abort that baby, especially if their doctor told them they had to. How many times have I heard, my doctor told me I had to have an abortion. The baby was not viable. And, you know, this is inexcusable. How many women who come to a doctor have the guts, really, to challenge them, especially if they haven't done their homework before they come to that appointment? It takes a lot of courage to go out and research. You know, my doctor told me I had to have an abortion. Well, first she has to not believe everything she hears. Then she has to go out and research on her own and find out, well, there are some other options, like continuing the pregnancy. Pregnancy is a healthy state. That's, you know, all of us got here because someone was pregnant. And she chose life, thank goodness. And then take it to the next step. I am the head of the perinatal hospice program at our office. And I have women in our practice who come to me who have babies with terminal diagnoses. I have patients who come to us from other practices because they've done their research and found that we will support a mother who has a pregnancy that has a terminal diagnosis. You know, in the past they've been told, get rid of it, it's garbage. Try again. Why are you wasting your time? But when you look at the literature, our peer-reviewed literature, there is an inordinate increase in the number of women who terminate their imperfect babies and then have disordered grieving later. They cannot grieve properly. They cannot come to acceptance that this is what God wanted for them. And the Catholic piece is so well fitted to this need to help these women. The most vulnerable a woman will ever be is when she is faced with a life-changing decision, be that for herself or her unborn child. This is a very, very difficult time, and it's a time when we need to be supported by people who feel and practice the same way we do, who have a similar faith background. And quite honestly, if this bill goes through the way it's written, there will be no Catholic doctors. By definition, there can't be, because of the penalties that have been levied and the mental outlay of the medical profession as it's being dictated to by an administration that really has no business doing this and doesn't have the expertise to design a system that would allow for personal religious differences, religious beliefs, and religious support.